Obstetric fistula remains a major challenge in Kenya despite efforts made over the years to deal with it. More than 3,000 women develop fistula every year, and only 60% of them are able to access treatment. 33-year-old Chepkemoi is undergoing her fourth fistula surgery that has brought a multidisciplinary team of urologists, fistula surgeons, consultants, trainees and nurses to her aid. Her case is one of the many out there.
Theatre number 2 at the Kenyatta National Hospital. An operation doctors term as both complicated and critical is ongoing. Chepkemoi, a 33-year-old woman from Elgeyo Marakwet County, is lying on this theatre bed with the hope of feeling like any other woman once she leaves. Cheboy, or Memo as she loves to be called, gathered courage to narrate her story despite the pain. But it was cut short as she could no longer bear the pain. She was induced to sleep as a multidisciplinary team continued with their job. A job that would see Cheboy proud to be a woman. 19 years ago, Cheboy developed vesicovaginal fistula for the first time. She was 14 years old. She went through corrective surgery in Kapenguria at the time, only for the problem to recur 17 years later. The ongoing procedure is her fourth surgery. According to Dr. Weston Hisa, a fistula surgeon at the Kenyatta National Hospital, Cheboy's case is a complex one.
In a case like what we are dealing with, has a very severe damage of the urethra, very severe damage of the bladder, which has healed with lots of scarring, and is a young girl who experienced prolonged obstructed labor.
Obstetric fistula is a medical condition in which a hole develops in a birth canal as a result of prolonged labor during childbirth. It can occur between the vagina and rectum, ureter or bladder. According to Dr. Kisa, there are several factors that can lead to obstetric fistula.
Besides the childbirth, could be surgery, for example, surgery around the pelvis, surgeries on the bladder. We also have cancer, and cancer, when it spreads, it can involve the bladder, it can involve the rectum. And we also have, besides that, the treatment of cancer that we use called radiation, infections. So infections are not left out.
Yet fistula is almost entirely preventable. Its persistence is an indication of global inequality. It is also an indication that social and health systems are failing to prevent the most vulnerable women and girls. Due to the coronavirus pandemic, fistula corrective surgeries have widely been suspended as they are not deemed urgent. Dr. Hisa says there is need for massive awareness and collaboration between the government and the stakeholders to eradicate fistula in Kenya.
The best thing that can ever happen, because us, we are mopping the floor. The tap is on. The floor is mopped up with water. We are busy mopping the floor. We would like someone to close the tap.
Fistula is preventable and treatable, but if left unattended, it can lead to severe complications. For Cheboy that has been here not once, twice, but 4 times, hope springs eternal. Emily Chebet, Citizen TV.